Good morning, everyone. On behalf of OSGU family, I extend a warm welcome to all the esteemed dignitaries, faculty members, and most importantly, all the delegates on this international conference on emerging trends in pharmaceuticals, health, and applied sciences in collaboration with Bingham University, Nigeria. I welcome you all for this first technical session that is chaired by Dr. Sunil Dwivedi and co-chaired by Dr. Basanti. First of all, I would like to invite our first delegate, that is Ms. Rajni Singh. Ms. Rajni, is she online? The title of her paper is Synthesis and Characterization of Moronic Acid-Loaded Ketosol Nanoparticles. Miss Rajni, is she online? Ma'am, can you please come online and present the paper? Ma'am, am I audible? Miss Rajni Singh.
स्क्रीन भी मैंने शेयर कर रखी है। सर मैंने चेक किया था, उसमें तो आवाज आ रही थी। सर स्क्रीन शेयर हुई? मैंने ओके सर। आ रही है सर आप? हेलो जी
मम्मा
बोलना नहीं है बेटा।
ये तो कर दो।
हाँ जी सर।
मम्मा ये बाजरा मैं यही करूँगी। हम यही करेंगे।
Good morning, everyone. Myself Rajni Singh, and I'm a PhD scholar in OSGU. My topic is synthesis and characterization of moronic acid loaded chitosan nanoparticles. Content, introduction, methodology, result and discussion, conclusion, and reference. Nanotechnology in cancer treatment opens a new pharmaceutical research frontier. Nanoscale drug molecules are a novel, effective bioactive loaded nano platform for cancer cell treatment. Many cancers are treated with chemotherapy. Nanoscale bioactive compounds have improved antioxidant and anti-cancer activities and low dose bioavailability. The US National Institute of Cancer has sponsored research into plants' secondary metabolites' anti-cancer effects. Recent studies have shown that nanoparticle morphology is critical for anti-cancer efficiency with minimum adverse effect, size, shape, surface effect, nanoparticles, pharmacokinetics, and pharmacodynamics. Saponin, glycons, and free carboxyl
मम्मा खुद करो क्या
Saponin A-glycans and a free carboxyl acids are moronic acid pentacyclic triterpenoids. Glucocorticoid receptor transformation reduces BC12 level in Michigan Cancer Foundation 7 breast cancer cell lines. Due to its low toxicity, moronic acid is used as topical and oral medicinal formulations. An antigen for encapsulating several medications should be biodegradable and biocompatible. Chitosan, a new medicinal encapsulation ingredient, increases encapsulation efficiency proportionally with the gum concentration. The goal of the current studies was to develop a amyloided polymeric nanoplatform to increase bioavailability, create synergism, and mitigate side effects. The polymeric nanoparticle extended release and better therapeutic efficiency at low dosage are made possibly by encapsulation of moronic acid. Material Methodology Materials Chitosan as acquired from the French company MP Biomedicals LLC. The compound moronic acid with a purity of above 90% was acquired with Sigma Eldridge in India. The National Center for Cell Science NCCS located in Pune supplied the MCF7 cell line which consists of human breast cancer. All the chemical used in the studies were of the analytical kind. Preparation of moronic acid loaded chitosan nanoparticles to make the moronic acid loaded chitosan nanoparticles. An oil in oil emulsion solvent evaporation process was employed. Dissolve in 100 millimeters of propanol with 150 milligram of chitosan and 50 milligram of moronic acid. The solution stated earlier was mixed with 25 grams of magnesium cerate and then stirred magnetically at 1000 rotation per minute for 30 minutes. Add 60 cc of liquid paraffin oil slowly to the mixture. After 10 hours of continuous stirring at 1000 rpm at 40 degrees Celsius and 40 minutes of centrifuging at 9000 rpm at 4 Celsius. We used a freeze drying technique to dry the pellet after separating it and suspending it into a cryoprotectant, D-mannitol and 5%. Characterization of synthesis, MCNPS, the average size and average distribution of optimized nanoformulation of moronic acid were evaluated using the Zeta Sizer Nano ZS90. The supernatant containing the unbound medication was collected and analyzed by HPLC. Following a 40-minute centrifugation at 8800 rpm, and the encapsulation efficiency was to 100 is the formula for the percent entrapment efficiency. The optimized batch of MCNPS size and morphology were examined using a transmission electron microscope.
Rajni,
The Fourier transform
sorry.
infrared spectrometer was used to analyze the FTIR, analyze of moronic acid, chitosan,
Hello.
and MCNPS in the region of 4500 to 500 centimeter. In vitro
Hello.
assay of cytotoxic activity,
I'm
MTTSA,
sorry to interrupt.
both healthy and malignant cell lines were cultured in media with 10% inactivated FBS solution, 81 by 1 ml, streptomycin, and 80 penicillin in
Hello.
370
Rajni,
degrees Celsius.
hello. Rajni, I'm sorry to interrupt. You have 2 more minutes to wind up.
Sorry, ma'am.
You have 2 more minutes to wind up your presentation.
Okay, ma'am.
Hello? Hello? Please, name of the nanoparticle.
Both healthy and malignant cell lines were cultured in a media with 10% inactivated FBS solution, uh, 80 streptomycin and 80 penicillin in 370 degrees Celsius, 5% carbon dioxide atmosphere subculture under the sterile laminar airflow with 0.25% ribosine were done after 75% confluence in 96 well plates. Cell seeding was examined. Each cell line density was assessed by its growth pattern, 3 days with varying concentration of OTDPNs and olinolic acid. After 8 hours of incubation, optimize the wells. After raising the cells, 31 of MTT solution was added to the culture and incubated for 3 hours. The percentage of metabolically active cells were compared to untreated control based on the mitochondrial conversion of MTT to formazine crystals. Formazine crystals were dissolved in DMSO and measured at FT 570 nanometers.
Yes. Hello.
MCN
Yes, Ms. Rajni. Please conclude and tell us which cell lines you use for your culture. Just conclude your results only. Because your time is over now. Just conclude it. What are the outcomes in future research outcomes for presentation?
Ma'am,
Only in
sorry,
the
your
only in the brief Rajni. Yes, yes. Which cell lines you use for the PTSA? Which cell lines you use for your MTT assay for the toxicity testing? Is that audible?
hello.
Rajni? Yes. Rajni, which cell lines you use for your toxicity assay testing?
Hello.
Which type of cancerous cells you use for your assay? Is that audible? Rajni?
Hello. Rajni, ma'am, are we audible to you?
Yes. Thank you, Rajni.
Ma'am, may I continue?
No, no.
Your time is up.
You just conclude your results.
You have to conclude your results. Your time is over. So please conclude.
Ma'am, hello.
Hello. Yeah, you are audible. Please speak.
Rajni, you are audible or not?
And also,
Ma'am, next.
Ma'am, may I continue?
Ma'am, your time is over. I think we are not audible to you. Now, I would like to invite our next participant, that is Miss Sania Makkar. She is a research scholar from Hisar. Miss Sania Makkar, and you have just 10 minutes to present your presentation.
Good morning, everyone. I'm Sania Makkar from Biotechnology Department.
Sania ma'am, please switch on your camera and your presentation is also not visible.
Ma'am, I'm unable to share my screen.
You can just restart your presentation. It's not visible.
Ma'am, I didn't find the option to share the screen.
So you can mail the presentation to the contact person, that is Dr. Mukesh. Now I would like to invite our next participant, Miss Sakshi.
Yes. Hi, good morning, everyone. Let me show you my screen
Please
first.
switch on your camera.
Yeah, sure, sure.
And your presentation is also not visible.
I'm just sharing it, ma'am. Just a second. Is it visible, ma'am?
No, not yet. Please switch on your camera and your presentation. Please share your screen.
I'm just doing that only, ma'am.
Okay, no problem. Yes, now it's visible.
Is it
Yeah,
okay?
your
I have already
presentation
switched
is,
on the camera. So, okay.
and you have to conclude it in 10 minutes.
Sure, ma'am. Okay. Good morning, everyone. My name is Sakshi, and my guide name is Dr. Vinod Kumar. My topic is availability analysis of a NIDAC manufacturing plant. So here's the in the present paper, the mathematical model for availability analysis of NIDAC manufacturing plant is developed in the six subunits. I'll tell you about six subunits in the further slides. So a single repairman who examines and repairs the units as and when need emerge. Availability of NIDAC plant is determined with the assistance of RPGT. I'll tell you this also in the next slide. And accessibility of the arrangement of NIDAC plant for various values of repair and failure rates of subsystems is additionally determined. So graphs are drawn to depict the behavior of the MTSF, that is mean time system failure, availability of the system, busy period of the server for a particular case. I'll show you these graphs in the further slides. So here is an introduction. This brief discusses the behavior analysis to analyze transient behavior of repairable NIDAC plant. using RPGT. What is RPGT? This is regenerative point graphical technique. This defines various parameters such as mean time to system failure, availability of the system, and server of the busy period, expected number of server visit, profit functions. So these are the parameters. So here I'll tell you about the 6 subunits that I told you. First is CNC machine, that is represented with K, capital K. Next is VNC machine, that is represented with capital L. CNC hobbing, that is with M. Induction hoarding with N. Grinding machine with O, and polishing machine with P. So Nidec plant is very complex system. A solitary server which is 24 by 7 hours accessible fixes the entirety of the subunit. All units have unmistakable failure and repair rates in all states. So, a lot of researchers have worked in this field of reliability to find out the availability from different by using different techniques, such as Dr. Vinod Kumar, Dr. Rajwala, Dr. Deepika Garg, Dr. S.C. Malik, Dr. Sunita Kumar. Yeah. So this is the system description that I told you, the 6 subunits: CNC machine, VNC, how they work and what they work. Okay. So here are the assumptions and notations that we are going to use further in the graphs and the diagrams. So first is facility of single repair is consistently accessible. Repairs and disappointment are factually autonomous. The system is talked about for steady state conditions. Initially, the framework is acceptable and in state of full limits working. So here we are going to use alpha and beta, alpha I and beta I. Alpha I denote the failure rate, beta I denote the repair rate. I'll tell you about this in the diagrams. So this is the transition diagram. I told you about K, L, M, and OP. These are the 6 subunits, the machines. So capital letters represents the failure rate, and small working state. Sorry, the capital letters represent working state, and wherever the bar you can see in the parallelogram shape, there is K, L, M bar and OP 4. So this bar represents reduced state, that is when the repairman repairs. And the small letters, there are some small letters in few shapes, the rectangle shapes. So these small letter represents failed state. So next is evaluation of path probabilities. So applying RPGT and utilizing one as initial state of the framework. So these are the ways that we are going to use. Next is modeling system parameters. So I told you about MTSF, that is mean time to system failure and availability of the system. So these are the 2 formulas that I'm going to use. And next is particular cases. This is the graph and the table. Here is shown on the screen, mean time to system failure graph this is. If I fix the beta value, that is 0.50, that is with blue line, and this is beta 0.50, and alpha, if I see the value of alpha, if alpha increase with fixed beta 0.50, the values, the mean time will decrease. Similarly with beta 0.60, if I fix this value, alpha increases, the values, mean time value will increase. Similarly in availability of the system, in this also, if I fix beta value, we can see alpha increases, the availability will increase. Again with beta 0.60, 0.70, we can see that these values are increases with increase of alpha value. Yes. So here are the references. Thank you.
Hello. Hello, Sachi. Please, what are the functioning of CNC machine you are using your topic? So please, what are the function of CNC machine? Why are you using?
Yes, sir. Yes, sir. Sorry, sir, I can't hear
Why
you.
are you using the CNC machine?
Why are we
Hello.
using?
Why are you using the
Hello.
CNC machine? Hello.
Sir, I'm not getting your
Why are you
voice.
using CNC machine?
Why are you
Okay.
using the CNC machine?
Okay. Yes. CNC machine is used to remove the bend of the part which is received from the press shape. When we pressed, like it can be sometimes pressed of the shapes. So it's to remove the bend of the part.
Okay.
And what is the
Is it audible,
importance of
sir?
your to the society?
Okay. So
How it
the importance
contributes?
of, sorry.
You are audible. You can speak. You are audible.
Okay. Okay. So what is the
Yes. What
question?
is
Can you repeat, please? What is
what
the
is the importance of your research to the society?
okay importance? Yeah. So it will give like profit. Availability is range of availability is from 0 to 1. So we will give you the profit to the plant to decrease its failure, repair state, and so we will increase their profit by decreasing their failure rates.
This benefit goes to direct plant. I'm asking regarding the society's social importance. Importance to the society.
So importance to the society is when there is like less rate of failure and repairment, so they can produce more products. So society can get more and more products regarding this, and cost will decrease accordingly. So
Thank
I'm
you,
working
ma'am.
on a chip. So yeah,
Okay, thank you. Now I would
thank
like
you
to
so
call
much.
the next participant, Miss Nisha. She is also a research scholar, Miss Nisha. Are you connected with us?
Ma'am, am I audible to you?
Yeah, you are audible.
Sure,
Please
ma'am.
share your screen.
I don't know, but I'm not getting the option of screen sharing.
And you can just mail us to Dr. Mukesh your presentation if you can't share your screen. So till then, I would again like to invite Miss Tanya Makkar. Miss Tanya Makkar, am I audible to you? Ma'am, please switch on your mic. Miss Tanya. Miss Tanya Makkar, am I audible? Please start your presentation.
Audible?
Yes, you are audible. Please start your presentation.
My topic is fidaxomicin loaded nanoparticle enhance synergistic activity against Clostridium difficile. Ma'am, next slide.
Next slide कौन करेगा?
These are the contents. First is introduction, methodology, result and discussion, conclusion, and last one is references. Introduction. Clostridium difficile is a gram-positive, anaerobic, and toxin-producing bacterium which infect the colon. C. difficile is identified as enteric pathogen which causes antibiotic-associated diarrhea and pseudomembranous colitis. Spore formation is also important. Spore formation is also important for transmitting CDI because spores can withstand harsh environments, including radiations, high temperature, extreme freezing, and chemical disinfectants. To effectively prevent the transmission and recurrence of CDI, inactivation of spores is critical. Many nanoparticles types silver, zinc oxide, and magnesium oxide can inhibit spore dormancy and reactivation. Current sporicidal mechanism rely on the release of the metal ions of the nanoparticles which might be absorbed by the intestine. Therefore, an ideal sporicidal nanomaterial should target a specific spore but not release potentially toxic metal ions. We previously reported that single crystal non-stoichiometric Fe3O4 magnetite nanoparticle was sporicidal was uniquely spore binding. However, those nanoparticles were unable to inhibit Clostridium difficile vegetative cells. On the other hand, fidaxomicin alone was unable to eradicate C. difficile spore. Thus, outcomes were often relapses of the disease. In this study, we developed fidaxomicin-loaded Fe3O4 magnetite nanoparticles to target and inhibit both the vegetative cell and the spores of C. difficile. These are the methodology. First, preparation of the Fe3O4 iron oxide nanoparticles. Fe3O4 iron oxide nanoparticles were synthesized using thermal decomposition as previously described. Briefly, 1.42 gram of iron acetyl acetone was mixed with 0.57 ml of oleic acid and 20 ml of triacetylamine. The solution was refluxed at 325 degrees Celsius in an argon environment for 30 minutes. The solution was then cooled to room temperature and washed with a toluene ethanol solution. A magnet was used to concentrate and collect the nanoparticles, which were then transferred to chloroform solution and mixed with 0.4 mg per ml of prostate specific membrane antigen for 6 hours at 55 degrees Celsius. Finally, the PSMA coated nanoparticles were collected and washed 3 times with high purity water. Next slide. Confirmation of fidaxomicin modified nanoparticles by FTIR technique. FTIR was used to confirm that the fidaxomicin Ma'am, am I audible?
Yes, ma'am, you are audible, but because of
Ma'am,
some
I'm
technical
unable to
glitch,
hear you.
ma'am, you are audible. Hello.
Ma'am, I can't hear you.
Because of some technical glitch in the system, I would request all of you to please wait for a few minutes.
Hello, ma'am.
Ma'am, you are audible, but there is some technical glitch in the system.
Okay, ma'am.
So please wait for a few minutes.
Okay, ma'am.